Dr. Trost, what is considered a normal size, a normal length, and a normal girth of an erection?
Well, it's kind of a tougher question to answer accurately, just because when you look online, like let's say you go into Google and you type that in, you'll get these various algorithms and they'll say, roughly 5 inches is kind of a normal penile length, 5.1 inches or somewhere in there. And, the standard deviations, fifth and 95th percentiles down in the 3 range and up in the 6 range. But it's tough because it depends how you measure it. And measuring a true erect length is really difficult to do. And so usually in the office, we'll use a surrogate, which is stretch length. And the way that technically we try to keep it standardized is we push all the way to the pubic symphysis, and then we'll go out toward the head of the penis, towards the rim or the corona, and we'll call that the length. But so you have to keep that in mind. When you're looking at anything online, what's the method that they use? Did they go to the tip? Did they push the kind of that suprapubic fat pad in? Or are they just looking at visual erect length? Because a lot of times when someone feels like they've lost length, they're talking about like the visualized portion that they see with an erection or flaccid, but they're not necessarily looking at the true stretch length if you pushed all the way into the pubic symphysis into the head. So I know that's kind of a roundabout answer, but it's tricky. It also matters regionally. Like if you look at someone from kind of Southeast Asia versus Europe versus Africa versus North America, you're going to get different lengths as well. So, what is normal? Well, what's your background? What's your heritage? And, what have you had done? Do you have diabetes? Have you had a prostatectomy? Do you have Peyronie's disease? There's different normals within each of these categories.
Yeah, tremendous amount of variations.